If you've just found out that you're pregnant, well, congratulations. You're about to really embark on one of the most exciting and transformative journeys of your life. But I also know that the first trimester can come with a lot of questions, maybe even some surprises between what's going on in your body, what's going on with your baby, and really wondering how to manage pregnancy symptoms. Sometimes it can really feel overwhelming. Well, if so, you're in the right place. I'm Dr. Pinnock, and I'm a board certified OB-GYN and high risk pregnancy doctor, and I'm really passionate about helping you to have a healthy and enjoyable pregnancy. So, in this video, I'm going to touch on some common first trimester symptoms, information about your baby's development, things to know about prenatal care, nutrition, self care, as well as some tips to know for when to reach out to your healthcare provider. So let's dive right in. So what are some of the most common symptoms you may experience in the first trimester? Well, let's go through the big ones. I have detailed videos on natural ways to tackle morning sickness and other first trimester symptoms that I'll link below. But in terms of the big symptoms that you usually experience, these include fatigue, and that's completely normal. Your body's really working overtime at this time to support your growing baby, and that can leave you feeling wiped out. So just listen to your body and rest when you can. The other big symptoms that you may experience is morning sickness. And this one's famous, and you may be feeling nausea in the morning, in the evening, honestly, any time of day. And small, frequent meals, ginger tea, staying hydrated can really help you to feel better. Some other symptoms you may feel are breast tenderness. You may notice that your breasts are becoming more sensitive or even a bit swollen. And this is just your body preparing for breastfeeding way down the road. But believe it or not, the preparation starts in the first trimester. You may also feel frequent urination, and that's thanks to some hormonal changes and your kidneys working harder and harder. So you may find yourself visiting the bathroom a lot more often than usual. And lastly, another big symptom that you may feel in the first trimester are some mood swings. So this is because of all those hormones just surging through your body. You may find yourself feeling a little bit more emotional or moody, and that's actually totally normal. So just give yourself a little bit of grace as you get through this early pregnancy phase. Now, let's talk about the exciting part, your baby's development. During the first trimester, your baby grows from a tiny collection of cells that is not even visible to the naked eye to the size of a lime by week 13. So here's a week by week highlight of what's happening with your little one. So during weeks 4 to 5, your baby's heart actually starts forming and begins to beat. And between weeks 6 to 7, the little arms and legs start to bud. And by weeks 8 to 9, the facial features like the eyes, nose, and mouth start to take shape. And by weeks 10 to 12, the major internal organs like the brain, the kidneys, the liver are starting to form, and your baby is actually starting to have a little movements, although it's way, way too early for you to feel those kicks just yet. But all exciting and rapid growth that you experience all in the first trimester. Now, let's jump to what you may experience during your prenatal care as well with your first visit with your OB provider. Now, your first prenatal visit typically happens at around week 8 of pregnancy, and at this appointment, your doctor or provider will confirm your pregnancy. They'll tell you when your due date is, and they'll also perform some really important screenings for your health. So you definitely want to make sure you get that appointment done early and not too late as the pregnancy progresses. You'll also have your first ultrasound. Now, seeing your baby on that screen is a moment you'll never forget. Now, this is also a great time to ask any questions that you may have about diet, exercise, or really any symptoms that you're experiencing. So please don't be shy. Your healthcare team is really there to support you and your baby. Now, taking care of yourself is so important during pregnancy, but it's especially important in the first trimester. And the reason for this is really when your little one is growing really, really fast and all those important organs are developing. So it's really important to really take care of yourself and to make sure that you're well nourished. Now, here are a few tips that I have. First is taking some prenatal vitamins. Now, prenatal vitamins with folic acid is something that you should be taking or have started if you haven't yet started. And if you haven't, I recommend starting right away. Folic acid helps to prevent neural tube defects in your baby, which is when there's an opening in the spinal column, and is really, really crucial for your baby's development. Having a balanced diet is also really important. So really try to eat a balanced diet rich in fruits, vegetables, proteins, whole grains, to have a nutritious and well-rounded diet. And unfortunately, if nausea is making it difficult to do that, don't worry. Now focus on small, manageable meals that you can tolerate, that don't make you nauseous. And also talk with your doctor about other ways to ensure that you're getting the nutrients that you need. Another big one is staying hydrated. So drinking plenty of water to stay hydrated, especially if you're dealing with nausea or morning sickness, is really, really important. And lastly, getting all the rest that your body needs, because pregnancy is a lot of work and your body's just starting out. So make sure you get all the rest that you can. Now, while most early pregnancy symptoms are completely normal, there are a few ones that I want you to watch out for, and definitely call your healthcare provider right away if you experience any of the following, such as heavy bleeding, severe cramping, really, really intense nausea or vomiting that causes you to feel really dehydrated, or if you're having severe dizziness or feeling faint. Those are all reasons to reach out to your healthcare provider right away. It's always better to be safe and check in if something doesn't feel right. So there you have it, an overview of what to expect in the first trimester. I really hope that this video has helped you to feel a little bit more informed and a little bit more at ease about the changes that your body is going through or will go through over the upcoming weeks. And always remember that pregnancy is a unique and special journey, and everyone's journey is different. But I'm so happy to be here with you every step of the way. And don't forget, if you are pregnant and you'd like to find out what foods to avoid eating in pregnancy, take a look at my checklist about 10 foods to avoid eating in pregnancy at badpregnancyfoods.com, or you can find it at the link below. And as always, if you found this video helpful, be sure to hit that like button and don't forget to subscribe to my channel for more tips and advice as we continue this journey together. See you on the next one.